I've spoken to people who have recovered from addiction, and in fact, I don't know if a single one of them has ever said that their first time
Right.
trying to get clean was the one that stuck, but they
Yeah.
kept going, they persevered, and they had people around them that didn't let them give up.
Yeah. Hi, I'm Mike. On this episode of The Journey, we discuss addiction from the perspective of the human condition and how we can support people, both who are embroiled in it and those trying to get free from it. As well, MP Andrew Lawton opens up a bit about some of his own struggles. Have a listen. So, changing gears just a little bit. So, Alberta has a program that's kind of unique in Canada, which is a pretreatment program.
Mm-hmm.
So, basically, from the time that you say, I've got a problem to the time you actually get in treatment, there is a place where you can go, a sober living environment, to try to bridge that gap, because it's impossible. If you say, I've got a problem, and you get sent right back to where you're doing your drugs, none of us are going to be able to last with that, right? So has that taken root at all? Has there been any notice to your understanding in Ottawa that this could be something that could be beneficial across the country?
Absolutely. I mean, my party, I'm a conservative MP. My party in the last election had looked at really pushing that recovery model and learning a lot of the lessons from Alberta.
Yeah.
I think that's where a lot of Canadians are right now on this. And I mean, conversations I've had with you about this have been particularly inspirational, and that understanding that as many times as it takes, we will
Right.
keep helping and keep trying. And I've spoken to people who have recovered from addiction, and in fact, I don't know if a single one of them has ever said that their first time
Right.
trying to get clean was the one that stuck, but they
Yeah.
kept going, they persevered, and they had people around them that didn't let them give up.
Yeah.
And those stories have been some of them you've had on this podcast. I know, like
Yeah.
those stories are just so incredible. And so I think that we need to do that, and I think we also need to understand the harms that people are causing to themselves
Right.
with addiction. And it's not about judgment. And I've never dealt with addiction, but I have dealt with mental illness, and I almost lost my life to suicide 16 years ago. And it was not my only attempt. It was the last one, was the one that almost succeeded. And I dealt with the in and out of mental health treatment for what was very severe depression. And the law allows the state
Right.
to intervene if you are going to hurt yourself or hurt someone else.
Right.
And what we see people living in the throes of drug addiction are doing is very similar. They are killing themselves in a lot of cases, and we need to come up with ways to intervene to prevent that from taking place. And it's not about. And look, I'm a person that wants people to have the maximum freedom in their life,
Right.
but you're not living in freedom if you are living in that cycle of addiction, which is often connected to criminality, to homelessness, to all of these other things, which
Absolutely.
are societal harms beyond the individual harm.
Yeah.
And anything we can do to disrupt that, we need to do.
So what was the, on a more personal note then, what was the trigger that on that last suicide attempt that you made, what made the difference to turn you around, to change where you were headed?
I've been asked that question before, and I think my answer is different every time, because I think I'm still, now 15 and a bit years later, trying to answer that question. I think the part of it was that I had gone so close to the brink,
right?
That I was in the hospital for 7 weeks, and I'd been on life support for much of that, and there was a rather dramatic moment. If not that anyone would watch a movie about my life, but if there were a movie about my life, there was a dramatic moment where, as it was told to me after, where one doctor was prepared to call time of death, and another said, "No, I'm not giving up," and continued with the resuscitation, and then I came back, and so I think that when you go through that, you really realize, did I want to die, or did I want the pain to stop? And that those two things are very different. And I think when you start to realize that there are ways that you can deal with the pain without ending everything,
right,
you start to be able to put that together. And again, it's not easy.
No.
You don't just wake up one day and say, okay, great, I survived this, and now I can go back into my life and everything's fine. No. And in fact, some of my darkest days were actually in the couple of years that followed that.
Yeah.
Because you still have the root issues that led to that, and now you have the added baggage of you've gone through this attempt to end your life, and everyone around you knows it. And that was something that for me was still a big challenge, but it wouldn't have been possible without the community.
Right.
It wouldn't have been possible to do in isolation. And I was very blessed to have a family around me that loved me and supported me, my amazing parents. And, that was something that I couldn't have imagined doing it without. And for me, it was also a part of my faith journey as well.
Yeah.
And again, I don't say that because I'm trying to push that on others, but I also can't separate my own experience from how that helped me.